Hi, and welcome back to Vepra Podcast. I'm your host, Anya, and today we're diving into one of the most urgent healthcare debates unfolding in Washington, D.C. This episode breaks down the real-life consequences of proposed federal cuts to Medicaid, not the headlines or the spin, but the direct impact on the people's lives. So we'll explore who qualifies for Medicaid, how many residents could be affected in states like Michigan, California, and New York, and why new data sharing between health agencies and immigrant enforcement is making some people afraid to seek care altogether. So here's what we know. Yesterday, the Senate Finance Committee has just released its version of the budget reconciliation bill, and it proposes even tighter restrictions on Medicaid than the House bill, particularly targeting state-directed payments and provider taxes. These are vital tools states use to keep their health systems running, especially for low-income and rural communities. The Senate proposal follows the House's passage on the One Big Beautiful Bill Act, which includes over $800 billion in cuts to Medicaid and the health insurance marketplace. A Senate vote is expected before July 4th. In response, healthcare leaders, including American Hospital Association President and CEO Rick Pollock, have issued strong warnings that any further reductions would make an already dangerous proposal even worse. So despite a wave of political propaganda claiming that there are not any real cuts that are leading healthcare organizations, including the American Hospital Association, confirms otherwise. According to AHA estimates, this legislation could cause 11 million people to lose coverage, devastate rural hospitals, and strip access to care from some of the most vulnerable populations in the country. So that's low-income families, seniors, people with disabilities, and immigrant communities. Medicaid, to give you a little bit of background, helps people with low income get health care. To qualify, you must be one. You must live in your state, be a U.S. citizen too, or meet immigration rules and earn below a specific limit. Usually that limit is under $21,000 a year for one person. Medicaid covers kids, pregnant women, seniors, and people with disabilities. States like California, New York, and Michigan also offer emergency Medicaid for undocumented immigrants. Now, applications are available online, mail, etc. Now, with $21,000 a year, that's practically in the brink of starvation. Okay, just to give you a little bit of background, what that looks like as far as like what the population size is in California that meet Medicaid, that's over 13.4 million residents. So the state could lose more than $2 billion in rural hospital funding, threatening access to areas already underserved. New York has an estimate of 7.5 million residents on Medicaid, and large hospital systems in New York City and upstate regions would be forced to absorb the loss or cut back critical programs. In Michigan, we're looking at 2.6 million residents that are on Medicaid. That's about 27% of the population. So in a state where 43% of residents earn less than the cost of basic living, the impact would be absolutely devastating. Rural hospitals are already in crisis. Nearly half operated at a financial loss in 2023, and 92 have shut down or ended inpatient care in past decade. H.R. 1 passes, and an estimated 1.8 million rural residents would lose coverage, and many would need to travel hours just to find a provider. There's a growing misinformation that these changes are harmless or even helpful. But trusted networks like the AHA are making it clear that these cuts, and they will harm millions. We cannot afford to ignore the ripple effects of the slashing care for populations earning less than $21,000 a year. These individuals are not just statistics. They're families, neighbors, and workers already on the brink of homelessness and hunger. Instead of cutting essential care, we should be focused on expanding access and opportunity, especially as we face a highly competitive job market and the rapid rise of automation and AI, which could reduce job availability. Slashing Medicaid now could worsen public health outcomes for everyone, not just the vulnerable. Alongside the legislative threat, we're seeing alarming developments in how Medicaid data is being used. In June 2025, an AP report revealed that CMS had been ordered to share personal data from Medicaid enrollees in California, Illinois, Washington State, and DC with the Department of Homeland Security. This includes names, addresses, social security numbers, and immigration statuses. The directive was issued under President Trump's executive order titled Ending Taxpayer Subsidization of Open Borders. This sparked major backlash from governors and privacy advocates. California Governor Gavin Newsom called the action potentially unlawful, citing violations of the Privacy Act and the Social Security Act. Critics warn that this could have a chilling effect, discouraging vulnerable individuals, including pregnant women and children, from seeking medical care for fear of being targeted for deportation. Anyway, so thank you for listening to Vepra Podcast. Whether you're a provider, an advocate, or someone who believes in compassion and justice, your voice matters. So call your representatives, join the national conversation, and help protected access to care for all. Until next time, stay informed, stay engaged, and stay united.